56 degrees on Monday. Look at that.
Not bad at all.
Wow.
We need some snow.
All right, in New York State tonight, some advocates and lawmakers are urging the governor to declare a public emergency to combat the opioid epidemic.
Our New York Capitol correspondent Elise Klein breaks down the issues and talks to the governor about whether or not this is something she would consider.
This week, advocates travel to Albany and rally on the Capitol steps, urging the governor to declare an addiction public health emergency to combat the opioid epidemic. Some advocates in recovery from addiction tear up, rallying for themselves and their friends.
I've been through a lot, like all of us who are in recovery have been through a lot. And I think one of the hardest things is now being in recovery and seeing people who so desperately want recovery but aren't able to get it because they don't have an opportunity to.
According to data from the New York State Office of Addiction Services and Supports, the number of opioid overdose deaths have nearly doubled in the past few years. More than 5,300 New Yorkers died from an opioid overdose in 2022. Sakala says one of the biggest obstacles facing this issue is funding to address it. Some lawmakers say if Governor Kathy Hochul declares a public emergency for this issue, it could open up more doors for funding and resources.
And what she should do is bring focus to the ongoing and growing problem of addiction in our state and bring focus by declaring it a public health emergency.
Governor Hochul says her office is treating this issue as an emergency but will not declare a public emergency at this time.
What an emergency declaration does, it simply allows you to bypass the normal channels for procurement. So yes, it's an emergency. We're focusing on it with a sense of urgency, but nothing at this time dictates that we bypass the normal channels.
In Albany, Elise Klein, Erie News Now.